I'm Mike Albanese, joined by Dr. Marcia Anderson. Now, Dr. Anderson, this year is not ending exactly the way we'd hoped with the variants. How was this year for you looking back?
It was a tough year, I'll say, both as a public health physician, as a mother with two kids who were at home remote learning for part of the time. It's been challenging to have a second year of a pandemic. So looking forward to this year ending and hopefully a brighter 2022.
What kind of work have you accomplished over this past year?
I'm very proud of some of the work that we have done. For example, releasing COVID-19 specific information disaggregated by race, ethnicity, and Indigenous identity. The work of our First Nations communities and pandemic response team on the vaccine rollout has really been remarkable. So proud of our 88.5% fully vaccinated coverage on reserve. The accessibility work that has been done, the urban Indigenous both testing and vaccine clinics, the outreach clinics to different areas in Winnipeg to meet the need of the higher rates of COVID amongst BIPOC communities. I think all of that has been the work that I'm most proud of contributing to.
You took to social media and you said one of the hardest parts of doing anti-racist, rights-based Indigenous health work is that constant feeling that you're not doing it enough, fast enough. Can you explain that feeling and what you kind of meant by that?
It's a tough space to be in, to both celebrate what we have done and also know that this type of change happens really slowly. And while we're working very hard with this anti-racism work, people are still suffering and being harmed by racism while we do it. And so there's an emotional labor component of it where you have to hold space for the grief that is associated with that. At the same time, you have to hold hope and passion and try to maintain your own wellness to stay in the arena doing the work.
Earlier in this pandemic, you did a presentation where you kind of spoke about the way that the pandemic and lockdowns are affecting BIPOC and marginalized communities. Can you just talk about how your work to really show that has changed the pandemic response?
Gaps in health by race exist full stop because of racism. It's not genetic or biologic. And so we have to be very detailed in how we talk about how racism operates to create these gaps. And that's what we've really seen throughout the COVID-19 epidemic. We know about widespread discrimination in housing, in employment opportunities, in education opportunities, and we know particularly how important housing is to COVID-19 transmission. We've talked about occupational risk as well. And so we have to keep the focus on those elements which are changeable because those structures are policies, they're legislation, they're funding decisions. And when we focus on where it creates those problems, creates those gaps in health, that's when we have the opportunity to try to fix and address them. I think a lot of the focus on the accessibility planning, for example, in the vaccine rollout, really was in response to the data that we were able to show.
Is there anything you hope that you can accomplish throughout the next 365?
I would really like to be doing more coaching and leadership development. Like many people, that type of work had to be put on the side to focus on the COVID response. And we have to be training our next generation of BIPOC leaders in order to be part of this work.
You recently got your kids vaccinated. You recently vaccinated Indigenous leaders across the city and even your own father. Can you just talk to me about those moments and what they meant to you?
It's that feeling that they're safer now. Like I know that they're safer now because they've had one dose of vaccine and they feel safer. And so for me, knowing that stress has been lifted from them a bit. And I would just say with the leaders, like with Grand Chief Dumas, I've always made time to prioritize these vaccine moments. Did it earlier with some first doses as well with some political leaders, because it's so important in setting that example and just reiterating as many times we can that every dose of the vaccine is important. And I just love to see the people that I love protected.
All right, well, Dr. Anderson, thank you for joining us, and I wish you and your family nothing but the best this holiday season.
Thank you, and same to you and yours.